Good morning. Welcome, everybody. Good morning, good evening, good afternoon, wherever in the world you're watching this from. I'm Dr. Vivek Kaul from the University of Rochester Medical Center and in Rochester, New York, USA. And I have the great privilege of chairing today's session 4 of the WGO Climate Course series for Global Gastroenterology. Today's session is titled Adaptation, Resilience, and Industry Partnership. And I'm very glad to have very distinguished colleagues join me here as part of the session. Two moderators for today will be Professor Justin Yong Ye Lee and Professor Amna Subhan Butt. Professor Lee is a professor of medicine and consultant of gastroenterology, hepatology, and internal medicine at the University of Sains in Malaysia. In Malaysia, JCI awarded him the Outstanding Young Malaysian Award in 2015 and the Top Research Scientist Award by the Academy of Sciences in Malaysia in 2018. Dr. Lee is president of the Malaysian Society of Gastroenterology and Hepatology and a committee member of the WGO, OESO, and ASGE as well. We're also joined by Professor Amna Subhan Butt. Professor Butt is a co-moderator for this session today and is an associate professor of gastroenterology at the Aga Khan University Hospital in Pakistan. Currently, she is the Secretary General of the Pakistan Society for the Study of Liver Diseases and an executive committee member of the Pakistan Society of Gastroenterology and a member of WGO's Clinical Research Committee. Our distinguished speakers today are Professor Cassandra Thiel and Rainer Burkard, PENTAX. Professor Thiel is an assistant professor at the NYU Grossman School of Medicine right here in New York and the Tandon School of Engineering. She's also president and CEO for Clinically Sustainable Consulting, LLC. Her research utilizes life cycle assessment and principles of industrial ecology to analyze and improve the environmental performance of medical systems. Dr. Thiel calculated the environmental footprint of a cataract surgery center, Aravind Eye Care System in southern India, finding that Aravind's carbon footprint for phacoemulsification was at 5% of the same surgery done in the United Kingdom. So a lot of work in that space, and we are delighted to hear from Professor Thiel first today. Rainer Burkard was appointed position of Global President of PENTAX Medical in April 2022, and he has a proven track record of delivering results through improving and developing, implementing strategic and operational changes in global multicultural environments. PENTAX Medical is a division of Hoya Group, and Mr. Burkard will be presenting the industry perspective today. To get things started, it's my honor to invite Professor Cassandra Thiel to speak about adaptation and building resilience, and this will be our first lecture. Welcome, Dr. Thiel.
Hi, I am Cassandra Thiel. I'm an assistant professor at NYU Langone Health and president and CEO of Clinically Sustainable Consulting, LLC. And I'm pleased to be here today to talk to you about adaptation and resilience building in the healthcare space. A lot of my work has been focused on the resource use in healthcare and monitoring the emissions associated with that so we can figure out the best ways to mitigate those impacts. But adaptation is a really important piece of the sustainability journey. As we know, climate change is changing everything. This is maybe an older slide at this point, but we've had, of course, lots of fires in the Western US, which have closed hospitals. My own institution, NYU Langone Health, was closed during Hurricane Sandy. It wasn't clear that they would reopen, but they had to evacuate patients in the dark in the middle of a hurricane. And in 2017, there were some critical shortages after a hurricane hit Puerto Rico, where a lot of pharmaceuticals are manufactured. And these are all things that will be more common, unfortunately, in the coming years as climate changes. Healthcare is responsible for a pretty large portion of emissions, and part of that is because of all the materials and supplies that are used to deliver care. And while a lot of us and a lot of you have been hearing about how we can mitigate that, right? We're trying to decarbonize care. One of the other elements of this is to adapt to climate change. Climate change is happening and it will continue to happen. Hopefully with mitigation, it won't be so severe, but we will have to deal with changing climate regardless of how well we mitigate our emissions. So there are some resources out there, quite a few resources about adaptation. And what we're really trying to do is respond to those risks so that we can reduce our vulnerability and reduce our exposure, because the hazards are out there, they're going to happen. And it's really how we respond to them that will determine how well we rebound from those things. So here you can see a nice graph from the IPCC's annual report number 6, where they've talked about climate change adaptation for health systems. And what you can see here is over time, right, there's some risks associated with just being out there in the world, and especially as climate change happens. And you may be experiencing some stress. So if you follow from the normal line on the left and the dotted line coming down, that might be, say, drought in your region, where you're feeling the stress, there's water shortages, whatever else, and then you experience a climate shock, that red vertical line. That shock might be a wildfire, for example. Now, depending on what you've done to prepare for these climate events, if you've done nothing, you may see yourself in a collapse where your hospital or health system does not reopen after that shock. Right? The wildfire was just too devastating. There's no sense in reopening your hospital. But if you've really prepared for this, if you've really thought about it and set up infrastructure and other systems to help you with this, you may experience a performance drop after that shock, but you might be able to recover to your pre-event state, or even better than you were before. And that's really the goal of being prepared for climate change, is the ability to adapt, to recover. And I think especially for healthcare facilities, it's important because we're an important part of the community, right? We're providing a very needed service. So what kinds of things can you do? The first thing you have to do is understand your exposure. And this is going to be kind of high level because each of you have different exposures and different priorities. So I can't specify exactly what it will be for you and your system. But essentially what you want to do is get a team of diverse stakeholders together. This is anyone who's interested in healthcare and has a stake in it, right? So from patients through administrators, doctors, nurses, waste management personnel, and utility companies. There's a whole bunch of people that want your health system to run well. And what you're going to want to do with that stakeholder group is identify who and what you care about protecting. These are otherwise known as your assets, right? So you might care about your patient population. What kinds of climate health hazards are they going to encounter? You might care about your ability to deliver care. So what kinds of things do you need to deliver that care? Do you need certain capital equipment, certain infrastructure, certain supplies? And you have to think about all of that stuff that you need to protect. All right, so a generic list might be your patients, your personnel or staff, the physical facility, your supply chain, right? Those are all assets for you. Next, you're going to want to identify the potential hazards that you're going to encounter. And again, this is specific to your region. So there'll be certain weather or climate hazards that you might experience: drought, fires, flooding, which could be coastal, and it could also be more freshwater flooding from storms and things. Hurricanes, tornadoes, ice storms, and cold weather are still very much a possibility. As the Arctic melts, it's blasting cold air out and causing these really intense cold snaps. So you have to think about those. Landslides and avalanches may become more severe with changes in rainfall patterns. So think about all those things for your particular region and the resulting hazards. So physical trauma for your patients, your staff, more disease, limited access to food and nutrition, necessary supplies of life. Maybe electricity and energy shortages, interrupted supply chains, unsafe waste treatment, and maybe even facility closure, right? Those are the resulting hazards. And then you're going to want to pair your assets and your hazards together. And some assets can have multiple hazards, and certainly there are multiple hazards affecting your assets. So you'll just develop a list of these things. For example, here, maybe some of your patients are vulnerable to extreme heat, and maybe one of your hospitals is particularly vulnerable to landslides. So you're going to want to map those together. You can look up geographical information, right? Are you in a flood zone? What are the trends in sea levels? Some weather information, changes to predicted rainfall patterns and heat indices, and maybe also look at biological hazards like diseases. So get a feel for those things. Again, you're trying to predict the future, right? So it's never going to be 100% spot on, but if you start identifying those risks for your particular assets, you have a better chance of being able to combat them. And there are a lot of resources out there to help you identify that. This is one example from the US. We have a US National Risk Index map where you can look at 18 natural hazards and kind of zoom into your geography and see what you're at risk for. So look for things like this from your government or your local municipalities. After identifying those assets and those hazards, you're going to want to look at the consequences of those hazards, right? So for patients experiencing extreme heat, you might find increased mortality and morbidity, particularly for older patients or patients with conditions like COPD. For a hospital that has encountered a landslide, maybe that will close your facility, right? That's a consequence of that particular hazard. So identify those consequences because that will help you identify which consequences are most severe for your assets. The next thing you're going to want to do is assess vulnerability and risk. So the first part of this is really asking, how do your assets cope with change? And one question is, how sensitive are your assets to climate hazards? And I've used the example of people as an asset. And as physicians, as healthcare practitioners, you know that certain patients are more sensitive to conditions than others, right? So infants that have lower immune systems are more particularly susceptible to disease, whereas immobile patients or maybe patients with less socioeconomic standing are more vulnerable when it comes to environmental conditions like heat and cold air and things like that, where their homes maybe aren't as well insulated or they can't physically get away from those hazards, right? So that's how sensitive your assets are to those climate hazards. You have to think about that. And another element of this is, does the asset have any adaptive capacity? This is, here I have the example of a vehicle. If your car, let's say, is a hybrid that runs off of both or either electricity or gas, then if there's a gas shortage or the electricity goes down, you have some adaptive capacity. You can switch over to a different fuel source. And so think about that as well. Is there adaptive capacity that you can lean on when you have a climate hazard? Next, you're going to characterize the risk for these asset hazard pairs. And I'm going to run through some examples. So those of you who are not overly fond of figures like this, bear with me. But you're going to want to think about your asset hazard pair in terms of probability. Is it low probability of occurring or a high probability of occurring? And then the magnitude of the consequence, low magnitude or high magnitude. And you're going to want to map your asset hazard pairs onto this. So one example might be the wildfire risk for one of your hospitals. Maybe the probability is kind of medium as to whether or not a wildfire will occur, but the consequence of a wildfire occurring in that facility is really high. Basically, the hospital would close down, right? So that particular asset hazard pair is in this red zone where we probably want to find some sort of adaptive solutions. Whereas, maybe it's a high probability that our staff will be exposed to mosquitoes, but a low consequence if they are. Maybe we're in a zone in the world where there's not that much disease spread through mosquitoes yet. Same with supply chain, maybe a low probability of flooding in the supply chain for pharmaceuticals, but it would be of high consequence. So that one's not quite in that red zone, but something to think about. And then perhaps other supply chain is vulnerable to tornadoes, but a low probability of it happening, and we can always go to a different supplier. So start mapping out those asset hazard pairs. Then you're going to brainstorm strategies to reduce your risk. And this is traditional, good old brainstorming session. You can get out the sticky notes and the boards and get your whole diverse team back together to talk about what to do with these particular risks you have identified. Keys here are, don't set any limits, right? Don't think about money at this stage. Just think about all the potential solutions that you could come up with. Can you decrease the sensitivity of your assets? Can you increase the adaptive capacity? You can look at other case studies. There are a lot of resources out there for that. There's one link here from the US government. And you might want, the reason you don't want to limit yourself is that some of these responses that you have, some of these strategies, might offer nice co-benefits or might address multiple hazards at once. So you want to brainstorm, you want to develop as many ideas as possible. One example of this would be if you have cleaner backup power, right, that reduces your local air pollution. So it co-benefits there for your community. You want to then prioritize those strategies and develop a plan for enacting them. And the prioritization, this is where the cost comes in. So this is where you start thinking about how much it will cost. And you also want to consider that some costs, if you're building infrastructure out, that might address multiple risks at once. So you want to answer yes, maybe, or no to the following 4 questions. Will this strategy increase resilience? Is it economically feasible? Are there environmental impacts with it? Are we also helping mitigate our climate emissions? And is it physically possible to do? Is it implementable? And obviously the strategies that have more greens are probably going to be the ones you lean towards. And you develop a plan for implementing those things, and you should actually implement it. So this, again, is very vague because you're going to have to identify what those strategies are, but there are a lot of ideas out there already, and certainly the people that you work with in your diverse teams will have some great ideas too. Any capital improvements, investing in infrastructure, those are truly investments from a financial and a physical sense. So you want to make sure that you do them correctly. You don't want to be built into, say, natural gas infrastructure and find out 10 years from now that natural gas is being banned or heavily taxed, and that you wish you would have gone with other infrastructure that wouldn't cost so much down the road. So think about all those things. And of course, track your performance and modify as necessary. This is not a one and done situation. With climate change, as we progress in a change in climate, we will learn more about how that climate is being changed in our specific geographies, and there may be new risks that you need to respond to in the future. So some examples of clinical adaptations on the infrastructure side, this is kind of a major area. Energy sourcing has shifted quite a bit for some institutions. So I have on here a cogen facility. This is essentially an electric power plant that also generates steam for hot water use. So in the lower picture here, this is NYU Langone's cogen facility. It's burning natural gas and generating hot water for the hospital and electricity for the hospital. It doesn't have to use natural gas or fossil fuels. Gunderson Health, which is a health system in Wisconsin, their main hospital has a cogen facility that uses wood chips. So it's a semi-renewable resource and certainly a local resource. They source all of their energy from almost the same footprint as their patients are coming from. Solar panels are, of course, a really increasingly popular option. The top picture here is Arvin Eye Care System in Pondicherry, where they've installed a bunch of solar panels. It doesn't meet all their power needs all the time, but it decreases their electricity bills by about 1.6 lakh rupees per month. It's reducing air pollution because, of course, the grid is burning a lot of fossil fuels, which is producing particulate matter and carbon emissions. So they're saving on that. And other studies in the Philippines in healthcare clinics there have found that solar panels add a layer of consistency to your power sources, which can actually increase the lifespan of your capital equipment because you're not getting those surges from the grid and whatnot. Other things to think about is the location of your energy sources. So NYU Langone, their backup generators were flooded in Hurricane Sandy, which is why they lost power. So they relocated their diesel generators to be about 30 feet higher than they were in the past, and they're behind submarine doors because we know that location will be flooded again. And so to prepare for that flooding, we've modified the location of where this particular critical infrastructure is. On the supply chain side, the activities here are also things that help mitigate climate emissions and reduce waste. First off, you want to reduce what supplies you're bringing in. This is especially critical for more developed countries where we tend to have a lot of supplies. And so you want to try to optimize your supplies and really start standardizing across your physicians if you can. Essentially, you want to use less. Reducing what you're using just means you need less, if you're in a critical situation where supply chains are hard, supply is hard to come by, you don't need as much supplies. And so that's important. Reusable supplies are also something to think about. And here we have just purely reusable items, and then also what's called single-use device reprocessing, which is a little bit more common, I think, in the US, where we take items that are designed for single use, pulse oximeters and cautery guns and things like this. And we give them to a third-party reprocessor who cleans them, sterilizes them, and sells them back to healthcare facilities. And it's not reusable like a reusable item is, in that it can only be reused 1 to 7 times, but it's some reusability. And any reusable item is really allowing you to control your stock, right? So we found out during the pandemic that all these single-use supplies we're relying on, when the supply chain breaks, it's really hard for us to adapt to that. But if we had, say, reusable isolation gowns, we would at least have something to protect our staff in. They wouldn't have to wear garbage bags to go to work. Excuse me. And finally, the supply chain, you want to think about your procurement practices, and you want to assess the risks in your supply chain. And again, it's not, you want to source from enough vendors. You want to have, variability in your vendors, but you want to have too many because you're trying to optimize on the economy of scale issue. So there is a balance on how many vendors you want to have for a particular product. But the risk in supply chain isn't just about how many vendors you have, it's also about where they're sourcing their material from. One of the things that we found during the pandemic was that even if we were sourcing gowns and masks from a US-based facility, they were still sourcing their raw materials from China, and that those raw materials were being funneled into other markets or just not being exported at all. So they were still unable to fulfill their contracts in manufacturing. And so those are things that you may want to think about. What are the critical supplies and the supply chain for those items, to know if you're going to have issues with those in any future climate events. Here are some great resources for you in your resilience journey. US government, IPCC has got some great ones, and this C40 knowledge, it's really for cities, but hospitals are like mini cities, so I think you can take away a lot of good information from there. And hopefully your own region, country, government would have some information on this as well to help you. Thank you very much for your time. I look forward to hearing your questions.
Thank you, Dr. Thiel, for that excellent presentation and overview. Please welcome also, and you've joined live as a panelist. I also want to welcome Dr. Leddin, chair of the steering committee for this series, and also Dr. Geoffrey Metz, obviously a big climate change advocate at the WGO and president-elect, and Dr. Bishr Omary. Thanks to all of you for joining us today. Our next presenter will be Rainer Burkard, who I introduced earlier for those who may have joined late, as the global president for PENTAX Medical. And Rainer will be presenting on the industry perspective related to climate change and gastroenterology, which is, of course, extremely important. And that's why we are here today in this session, to hear the perspective from industry. So Rainer, please go ahead. And I want to also mention that the live panelists on behalf of PENTAX will be Richard Burkard and Dominic Buren, who will be live and taking questions from the industry perspective on behalf of Mr. Burkard. Rainer, please go ahead.
Wonderful good day to you. I'm Rainer Burkard from PENTAX Medical. I'm the global president, and it's a true honor being here and being able to talk about ESG principles in the industry, being part of this VGO climate course for global gastroenterology, and talking about industry partnerships and what we are doing in order to address this relevant aspect of our being moving forward. So for today, what I've brought are a couple of slides presenting to you how we look at ESG principles, how are we adopting them, and what are the options moving forward for partnership, but also addressing ESG in general, not only from a healthcare provider side, but also what can the industry add in relation to this. Now, what you can see here on the next page, what we have decided to do is to really look into how we can explore this journey to sustainability, because we all agree to and believe and understand this is nothing we can actually achieve within a short period of time. So for us, it's about finding the right balance, how we can address sustainability moving forward. And for this, we have a certain mission, we have certain goals that we are adhering to. How can we address this environmental responsibility, our social responsibility, and what's the statement moving forward for us as an organization, and how can this work tomorrow? Now, finding this balance for us as a responsible medical device manufacturer, we really aim to find this balance between patient safety and the impact to environment and climate. It's not always an easy task to achieve, as we all know, because patient safety is a very important component, and often patient safety goes along with certain principles and certain philosophies of preparing products. At the same point in time, we all have to look into how we can address the environmental and climate impact moving forward, and how can we combine all of these different aspects into products and solutions moving forward. Now, from our side, there are many United Nations Sustainable Development Goals that are relevant for all of us. And we definitely understand the need for action, how to tackle these challenges, such as the climate change, and how to address them. As an organization, what we have decided, we were looking in all of these different goals and defined certain of those being more relevant than others to us. So these are all the goals that we have looked into and that we are actually within our organization addressing and introducing into the organization now for a couple of years. Within the presentation of today, I want to address specifically some more tangible ones for you connected to products and other areas, as you can imagine. But these are all the goals that we are working on, while I'm not going to go into details for all of them. Now, one of them, and think about this environmental responsibility, we are really addressing this through various aspects. For example, we have been working on reducing our freight volume through smart packaging. And that definitely has reduced the carbon footprint substantially, because through this reduction of volume, more volume can be packed in an airplane or in a ship, making the full transportation significantly more efficient and addressing the concerns. Another element is what kind of packaging material are we using? And that's not an easy one, because you all know, specifically when you enter the hospital or the other healthcare providers, how do you provide the possibility of having A, patient safe, but B, also ideally recyclable materials. And here you see an example, what could be done instead of having plastic, having recycled material, recycled plastic. And this here is a plasma bag, that's a big bag required for storage of endoscopes. And through this, what we can do is using recycled material, addressing sustainability, and raising definitely the bar on that behalf. You always can look into this, also not only for replacing the materials, but also providing a lower and lesser amount of it by testing each and every shipment device that you have to the full extent, and rethink the way how you are providing cardboard or cushioning materials. And this is what we have done in the last years as well, providing for a win-win situation, not only for you in disposing this waste, but also for lesser materials being required and making this more sustainable overall. This is not finishing with this, because what we're also looking into, and this is just an example of various aspects we are addressing ourselves. For example, here what you can see is replacing what was formerly a plastic bin, so to say, into changing this into a cardboard bin. That makes a lot of sense, a recyclable material that reduces PE form, no PPP. That definitely changes the way what you can do, and we are not stopping here. We're really looking into other materials. How can we replace more materials moving forward? This is just an example of what can be done and what we already have implemented as an organization within PENTAX. Thinking further, we also looked into how to reduce energy consumption. An example here is the Plasma Typhoon Plus product. And the Plasma Typhoon Plus product is actually a product is used to store endoscopes, but before this, dry the endoscopes completely, the endoscope channels. And here you can see the system in motion that is drying the scopes, and then after the drying process, you are adding them into a plastic bag, a recycled one, allowing for horizontal storage and reducing the complete process and the energy consumption almost to a minimum moving forward, specifically during storage. There are many more alternatives. One of them, and you all know this from the endoscopes, we definitely are working on the possibility to keep our endoscopes being able to be repaired. So we have the possibility to repair any of our products, any component of it, and we even are looking into the possibilities specifically on the electronic components. How can we refurbish those in order to minimize the footprints? How can we ensure that we don't have to throw those devices away? How do we refurb them and bring them back into the cycle of being reused? Now, this has been just a set of examples of what we're doing, and I want to talk a bit more of what we have done in between when we started to implement all these ESG goals and what can be done on top of it. Because many of the things I have presented to you now are addressing certain components, enhancing and improving them. What we believe, and this is where the industry partnership could become strong, is definitely how to develop new products. How do you think about it and how can you address this moving forward? You see here on the left-hand side, materials, devices, design, manufacturing, packaging, distribution, and disposability. How can you implement this in your R&D process? How can you ensure that when developing a new product, all these aspects are being taken care of? So what we have done within PENTAX, for example, we have embedded these principles within our R&D projects, meaning for any new project, people have to look into what kind of materials to use, how is the device designed, what can be done on the manufacturing side, how are we packing them, how do we distribute them, and what do we do at the end of the process? Can we bring them back, or do we need to dispose them, and what are the consequences of it? Today I can present to you one of our first products that are following this design principle and that is really addressing many aspects of sustainability moving forward. Now, let me introduce to you the Aqua Typhoon. What's Aqua Typhoon? Actually, Aqua Typhoon is a new device that will enable us to significantly change our processes of today, because what it does is it provides for a process that replaces the manual pre-cleaning of flexible endoscopes with a fully automized process, completely sustainable. You all know when you have to pre-clean endoscopes, you have to take brushes in order to clean the channels. You need a lot of water, you need a lot of detergent. We need to provide a whole process that takes typically 20 minutes for the pre-cleaning before these endoscopes will move into the washing and disinfection machine. Now, this new device uses new smart technology, air and water actually, in order to clean all the endoscope channels, all, before you put them into the washer and disinfector. And it really only takes 2 to 7 minutes. So it's a reduction in time. It uses more than 90% water less than the traditional process. And sorry for here the other component blended. No brushes and no chemicals. And that really is, you could say, a revolution of this process by rethinking what can be done, but also looking into how we can address the sustainability component moving forward. So this product really can reduce waste to a minimum moving forward. Against the existing process in cleaning, you reduce the waste by more than 99% and really provide for significant differentiation. This is not only relevant for this Aqua Typhoon, but also for the patient safety, because when you have an automated process instead of a manual process, you are reducing the human factor and you're increasing at the same point in time patient safety moving forward. And that definitely is another aspect that is for us of pivotal importance moving forward. Combined for sure with education, what can we do with healthcare professionals? How do we support you in your day? How can we train you? And for this, we have developed this Forward Academy, where many people are going to already in order to raise all our abilities using our products and addressing this moving forward. So for us, in sum, as actually PENTAX, we really work for healthy people and planet. It has been always our mission to help and improve people's life through intelligent solutions. And this is really what helps us to improve quality of people's life and contribute to a brighter future for coming generations. This is what we want to do. This is what I have presented you in a quick snapshot, only a few minutes, but providing you an idea of what industry can be doing, what we invite you to participate in doing with us. And unfortunately, I'm very sorry for that, I cannot participate in person to the course today, but we'll have 2 people from our organization that are ready to receive any of your questions. And please allow me herewith to introduce you to Dominic Buren, one of our program managers in R&D in PENTAX Medical, and also to Rich Burkard, a doctor himself that is coordinating our ESG efforts within the OA MedTech and Life Science. Those 2 gentlemen will now be available talking to you, addressing any of your questions, and we are more than happy to receive any questions moving forward and looking forward to partner with you addressing this important aspect for us in our daily business. Thank you so much for listening to me. I hope I could provide you some insights, and I hope you enjoyed this short presentation. Bye-bye.
Thank you, Mr. Burkard. That was, again, an excellent overview and some insight into PENTAX's own efforts in this realm. With that, we at the end of the 2 presentations, and now it's my distinct honor to introduce the 2 co-moderators for this session today, Professor Justin Young Lee from Malaysia, who's the president of the Malaysian Society of Gastroenterology, and Professor Amna Subhan Butt, who's also the vice president of the Pakistan Society for Liver Disease, and both are active members in several committees at the WGO. So welcome, Drs. Butt and Dr. Lee. And in the meantime, please do post your questions. I also welcome Dr. Cassandra Thiel, who's joining live and just gave a wonderful lecture, as well as Richard Burkard and Dominic Buren, who represent Rainer Burkard for the discussion portion of this webinar. So welcome all, and Dr. Lee and Dr. Butt, if you can come online, please.
Sure. Thank you, Professor Vivek. Okay, so the one question maybe Dominic could answer is about, can endoscopic companies consider using papers and cardboard packaging for all endoscopic consumables?
Yes, thank you very much for the question. Unfortunately, I cannot share my video at the moment, so you only have to hear my voice only. Yeah, so what we are doing right now, we are in the process of changing a lot of the packaging towards paper packaging or the recycling packaging. Not everything will be working with just paper. So we will have coatings on the paper, or we will have some other additives into that paper mixture. The reason for that is that some of the packaging that we are using has to withstand some certain regulations, and therefore we are trying to go within that space and see where we can use sustainable resources.
All right, so another question the PENTAX team could answer is about, is Aqua TPH Hoon compatible with the brands of endoscopic, other brands like Olympus and Fiji, other than the PENTAX?
I think I will take over this question again, Rich, right?
Sure.
So it is compatible. It was tested with the Olympus scopes and with Fuji scopes. So what you would need is a different adapter. As far as like the PENTAX, Olympus, Fuji users are used. You saw in the picture the tubes that are coming out of the device, and these can be attached to the different endoscopes.
Okay,
Right.
thank you.
Yeah, hi, Justin here, and splendid talk from Casey, and of course from the PENTAX. Probably I'll just address some further questions before we go to Casey. I think there's two questions. It could be related. One is that again to PENTAX, right? Whether what are the greatest problem that we see now is that there's increasing use of disposable scopes in the US, but in some other countries in Europe too. So how do you actually address that? You know, on one way that we wanted to reduce the carbon footprint, but on the other hand, there is increasing use of disposable scopes.
One of the reasons, or one of the points that we are looking in is why are single-use endoscopes being used? So that's one of the main questions. And there are cases where we have very dangerous bacteria that can be transferred from one patient to the other. So this is most likely a problem of cleaning the endoscope after usage. So the one thing is that we want to move forward with better cleaning solutions, better hygiene solutions for PENTAX, so that these cross-infections cannot take place anymore with the reusable endoscopes. And on the other side, we are looking into material changes for single-use endoscopes, for example. So can we make single-use endoscopy more sustainable than it would be right now? Can we limit also single-use endoscopy to certain cases where it's more sustainable to use single-use instead of using reusable? Because what a lot of people still would forget is that during the production of the endoscopes, there are different emissions being produced for reusable endoscopes and single-use endoscopes. So what the physicians usually see is the waste that is coming to the hospital and that they have to throw away. But the resources that are needed to produce reusable endoscopes are, for example, a lot higher than for single-use endoscopes. So you always have to have a trade-off between what is your focus? Is your focus infection risk mitigation, or is your focus more on the sustainability side?
And one of the things I'd add to that, I've done a lot of work on mitigation in a lot of different clinical specialties, especially ophthalmology, which of course has different infectious risk profiles. But we're trying to figure out, why we see this proliferation of single-use everything, especially in the US. And it does seem to be in the name of infection control, even though the numbers don't support, that the switch to disposables actually changes your infectious risks. And so I think one of the important things to do to combat that is to just ask why are we doing this? Where's the data that supports that this is better for infection control? It is the case, I think Anchandar here has noted that the transmission of pathogens is really for duodenoscope. Sorry, I'm not sure how to pronounce that word, but that these other scopes may not have as much issue with pathogen transmission. So just keep asking questions if your institution is looking at changing to disposables, because you may find that it's just someone's hunch and there's no data to support it, and you're going to have a lot of extra cost by moving to disposables, and it won't save you anything for your patients.
Mm-hmm.
I'll jump into thank you, Professor Thiel. I really liked your talk, and I think you spoke to it. It comes down to, especially me as a healthcare provider as well, is choosing and having leadership of an institution to choose sustainable procurement and considering these from a top level viewpoint about how to change clinical solutions in a sustainable light. And one of those ways, an easy thing to do is to consider reusable, or, you know, I work for also Microline, which is a colleague of PENTAX. We offer surgical solutions, but we offer reposable. So kind of a part of it is reusable and part of it is disposable, but offering solutions that are reusable can be reprocessed. But it starts with having leadership and a commitment towards a more sustainable procurement policy at your institution or in your practice.
Yeah, I mean, I think it's clear from even this brief discussion that the single-use versus reusable discussion is a very complex equation. And I think, you know, it has clinical elements, it has data elements, it has, you know, political elements. You know, so it's not an easy conversation. But safe to say that I think there is definitely some role for this new technology, and it's going to continue to evolve. I think positioning it will be something that we all are, you know, going to have to work on. Dr. Thiel, there's a question on for you in terms of being at NYU, which is a leading institution in the US in many areas. What specific initiatives can you speak to that are at NYU that are in play right now? And a corollary question to that is, how could some of those initiatives and strategies be adopted by low resource and underdeveloped countries right away?
That's a big question. So NYU on the adaptation front has done quite a lot because Hurricane Sandy kind of forced them to start from scratch with their infrastructure and of course reconcile the fact that they are really close to the ocean and are at risk of things like hurricanes and flooding. So they redesigned the whole facility. As I mentioned, they have a cogen plant, so they're generating their own electricity on site, and that's all the time. That's not just their backup generators. We do have backup diesel generators as required by law, and as I mentioned, they've elevated those, so they're no longer in our sub basement, and they've put them behind doors that can withstand water. Water's pretty powerful. So those are all the changes to just ensure that we'll have energy during the next storm. They're maybe doing a little less on the mitigation front than I would like, but they have been moving forward in a lot of different ways. So they're looking at their supplies. They're trying to, you know, you have these custom packs and surgeries, so they're trying to optimize those, trying to look at reducing supplies. There's not as much standardization in US facilities as you might see elsewhere, and I won't get into the reasons for that, but there's a lot of reasons. So, you know, we're basically continuing conversations, working on training and education for our staff when it comes to disposal and sorting properly. You know, there's a whole bunch of things there. What I'd say for the less developed countries and regions in the world, adaptation is probably going to be really important. I would say on the mitigation front, you're probably already in a good spot, like better than you realize. Certainly the work that I've done in other countries, India, South Africa, Brazil, usually those places are already pretty optimized when it comes to supplies, and it's because they don't typically have the budgets to say we're just going to spend as much as possible to pretend like we're doing something better for infection control. And so they're already pretty well optimized on those fronts, and they don't waste a lot. You know, exploring hospitals in India, they actually had, you know, whole arms that were devoted to repairing old equipment that they could get back onto the floors, like, you know, IV stands and stuff. Those are the types of things we would just throw away in the US. So mitigation front, you're probably okay. You want to make sure you're doing it all safely, of course, because otherwise if you do increase your infectious risks, you're actually increasing your carbon footprint as well for having to treat all those issues. But on the adaptation front, you do really want to look at what risks you're vulnerable to and what opportunities you have to potentially address those. There are a lot of, you know, nonprofits and potentially government-sponsored like tax rebates or whatever for installing solar panels and getting some of those alternative energies in place. And so take advantage of those where you can, but certainly think about your adaptive needs and your community's needs, and that will be different depending on where you're located. So unfortunately, I can't really give specifics, but.
Thank you.
Okay.
Maybe the other questions is from Bishr, where again, it's directed to PENTAX, whether or not there any positive impact that you have seen from some of the initiatives that you have changed from plastic to more paper-based packaging. Maybe
yeah,
Richard or Dominic.
Yeah, okay. So we have started collecting the data here. It's not something that we can openly claim right now, I would say. But we are looking into how to calculate this, because that's another problem. How do you calculate this? And you can calculate, for example, the plastic you have saved. You can calculate the packaging density that you achieve with the new packaging. So we decreased, for example, the packaging size for the endoscopes. But there's a lot more to the equation than just like plastic decrease or packaging size, because in the end, it depends on also how the supply chain is working. And this is something that we are trying to split up right now and see where we have the biggest impact and where we can optimize ourselves.
Right. Maybe Cassie, do you have any comments on how do you measure the impact out of adaptation?
Yeah, well, measuring impact of adaptation, I think, is maybe less clear in that, you just have to give it time and see how it goes. I think it would be looking at, certainly you can put some financials on your adaptive strategies, like how much did you invest in it? And let's say, the next storm rolls around, and instead of it being a 1-year storm, it's a 50-year storm, and you actually survived it, right? And you could see the places where you didn't lose money. So in the case of NYU Langone, right, if they had their building prepared for flooding, we wouldn't have lost decades of research. Our underground facilities were flooded, and that's where a lot of the research animals were stored. So yeah, it's kind of sad. But we lost lots and lots of research. We lost power to the institution, which meant the hospital closed for 3 months. That's a lot of, you could put in money, it's a lot of decreased revenue, but it's also just really sad for the community, right? So when you build out these things, monitoring it and really giving yourself credit where you've survived these storms is important, because I think once that infrastructure is there, it's easy to forget that it wasn't there initially, and that you may not have weathered that storm as well as in the past. On the mitigation front, I would say there are ways to measure your footprint, and perhaps that's what Dominic was talking about, in that you can't just think about decreasing plastic, though I know that in and of itself is a goal, but plastic is lighter weight and travels well and is very protective. And so in terms of carbon emissions, plastic may be a better solution, at least initially, than paper. So there's things like carbon footprinting and life cycle assessment that can give us some insights into what procedures or practices or materials will be better suited for the current situation, if our priority is to reduce carbon emissions. If our priority is to decrease plastic, that's a different issue, and they're not always aligned, unfortunately. But you can have longer term goals that will align both of those.
Right. So I have a question for Professor Thiel. So would you give any practical tips for the people about safe use of endoscopic accessories if they want to use them again? For example, the biopsy forceps and all. So the people in the different countries, low-income countries like Pakistan and India, there are centers they have been using after like cleaning, proper cleaning and all, and there were like very low risk of infections being observed. So what about any practical tips from this aspect?
Ooh. Well, caveat this with saying I am not an infection control specialist, and I'm not someone who works in central sterile or those areas. But there are procedures you can engage in to sterilize all this equipment, and I think the important part there is having a standard protocol and a set list, right? So that every time you clean these things, they're done the exact same way and they're done in a safe manner, and monitoring that process. So one of the things Dominic had mentioned is that cleaning can can be done improperly, and that can lead to these infections. And you know, I've often heard this complaint. If you have like a hospital central sterile where they're processing everything that comes through a hospital, and it's not like a specialized facility, you can get some things that are not cleaned well, some things that are damaged. So really making sure that your procedure is set up and everyone's following it every time, that is very crucial in maintaining safety.
Thank you.
Yes, this is an important question for the second and third world, because unfortunately the prices of accessories are almost prohibitive. And I believe that many years ago, there was data from India that when this question came up, that they had shown, at least from one center in Hyderabad, that recycling sphincterotomes and devices through their protocol back then was safe and effective, and wasn't presenting a significantly increased risk of infection. So that remains a debatable and controversial topic. And I was going to say that I think environmental issues are very strongly regulated by, or impacted by, regulatory and policy issues, and you know, until there is meaningful change in some of those, it becomes harder, at least in the first world, to impact change. So one of the questions Dr. Metz had asked was, Cassie, maybe you can actually for PENTAX first, and then maybe Cassie can speak to it too. Is companies like PENTAX working with leading societies or leading gastroenterologists and thought leaders around the world, or is that part of your equation in addressing this?
I can speak to this quick. We hope to. I'll let Dominic speak to PENTAX, but as subsidiary of Hoya, we have a group, an internal group called the Hoya MedTech and Life Sciences Company, and we have a monthly summit where we share all of our ideas. So from my side, Microline Surgical, to Wassenberg Medical, to PENTAX, and more. We meet, and all of our ESG participants at our distinctive locations share different ideas, share the different metrics that we're using, share our processes and the challenges. And I think that collaboration internally and with Hoya reflects our commitment to these issues. But I'll let Dominic speak to PENTAX specifically.
So we have reached out to the American Society, and we are currently reaching out to the European Society for these points. We have done a lot of studies in the past about hygiene, or with hygiene events. This is more addressing the sustainability aspect of giving better healthcare to the patients. But this is something that between a company and the physician or the clinical personnel, we have to really align, because usually the company has different goals than what the clinical personnel or the physician have. So what we are trying to do sometimes is not seen to the physician in the end, because the physician sees only the end product or uses the end product.
I can't comment on what's going on in this industry, but in ophthalmology, we've seen a lot of really cool collaboration. The ophthalmologists I work with are from some of the major US societies, and they've created this iSustain website, EYE, and isustain.org. And that provides resources for clinicians, but as part of that group, at their annual meetings, they meet with vendors through the vendor market to talk about, we should have more sustainable packaging. We should reduce our instructions for use, the paper packets that are in every intraocular lens for no particular reason. Well, I know there's reasons, but basically no doctor should have to read those IFUs to be able to operate. And so they're talking through all these issues that we've been bringing up today, and trying to come up with solutions that are beneficial for everyone, because there's a lot of things that do line up. These instructions for use, for example, is just added cost for the companies, and they're constantly sending out all this paper. They don't necessarily want to do that, but there are regulations in place that kind of force them to do that. So understanding the issues for everyone is really helpful in then putting pressure on the things that are
in the way, right? So we can change regulation then by having society support and vendor support to say we don't need paper instructions for use. We can put in a QRL code and it's totally fine, right? So having that consortium around is really important. And I think this just speaks to the need to communicate our desires for sustainability in all directions.
Absolutely. Thank you. Very quickly, yes or no answers, please, from Dominic, Richard. Does PENTAX share best practices in this space with other companies? First question. Second, do you guys provide any grants for investigators to study this?
Yes, and the second question, I'm not aware of this right now, but it's not out of question.
Understand. Thank you so much. Any final comments from the moderators, Drs. Lee and Butt?
No.
No, thank you very much for your informative session. Thank you.
As chair of this session, I want to thank all the speakers and the representatives and panelists, as well as the WGO Climate Change Working Group and all the leaders that are assembled here as well on today's call. This was a fantastic session, and I want to make sure that we remind everyone on today's call and the attendees that there's going to be the session 5 coming up on Wednesday, May 3rd, at the same time, understanding the carbon footprint of GI care. And it'll be delightful and amazing presentations from Professor Buhai and Heiko Pohl, who have done great work in this space. So thank you all for joining, and we'll see you at the next session.